value is equal to clinical outcomes divided by the cost. And the most significant piece in this is the clinical outcomes. And what ICHOM has done is that, and while they have made standardized sets, so it's easy to compare between hospitals. So you can standardize it, you can benchmark yourselves against the best in class. And since this started in 2012, and since then we are seeing a huge amount of interest, because we've been hearing about, reading about value-based healthcare. But I think so it is ICHOM who has spearheaded this and brought it to the notice of the global healthcare community and the public at large. There's still a long way to go, but at least a good beginning has been made. I see there's a growing enthusiasm. Like last year I was in the Boston meeting, and when I reflect back and compare this, I see more enthusiasm, more participation. And one thing, if you are seeing yesterday's survey, nearly 69% were first-timers. So that's a very good indication, because if you have the same crowd coming every year, year on year, that means that it indicates that this concept of value-based healthcare has not caught on, has not taken the interest of people. So I think the people are inquisitive and want to explore what is ICHOM about, how do we sort of take the good learnings from here, try to do it in our hospitals, in our setups. We started the journey by being a working group member for the standard test for coronary disease. And we piloted it in one of our major hospitals, which is a cardiac hospital in New Delhi, one of the largest, which does roughly around 300 angioplasties a month. So it's a huge volume when you look at from the global perspective. So we piloted it there, got it streamlined, got the buy-in of our clinicians, because earlier there was a lot of resistance from the doctors, because they were thinking that my results will be compared with others, and the other one will get a sort of talking about it, and I'll be demeaned. So we anonymized the data, and so that got the comfort of all the clinicians. And in 2016, we started publishing our outcomes on the website on a yearly basis. We should be looking at the patient. We always keep saying that patient-centric organization. But how are we taking care of the patient in the hospital and also after the patient leaves the hospital? And it should be a longitudinal journey. Michael Porter keeps mentioning that healthcare has become very episodic. We should take it over 6 months, 1 year, 2 years, 5 years, because there are different diseases that one can get. So if you start monitoring your patients on a longitudinal basis, there will be instances, and it is known that you can pick up things much early before things go from bad to worse. My message, as I say from India, is that I say that I think so we should be looking at doing it in a large scale in one of the emerging countries, whether it is India, whether it is Brazil, whether it is South Africa. These are things which are, because it will be in 3 important continents, and all are significant, have significant population. They have a good bench strength of doctors, nurses. So it will have a huge impact in the immediate vicinity.